Hey guys, welcome back to my channel, The ENT Resident. In my last video, I spoke about the anatomy of the tongue, where I briefly mentioned about the different muscles of the tongue. Now, in today's video, I'll be discussing more in details about the muscles of the tongue. Where do they have their origin? Where is their insertion? Their nerve supply? And what are their functions? So let's begin. So as I've discussed in my previous video on anatomy of the tongue, that the tongue is divided into two symmetrical halves by a median structure, a structure in the midline, which is known as the median fibrous septum. This median fibrous septum is coronally oriented in the posterior part of the tongue, and it gets attached to the hyoid bone below and forms the hyoglossal membrane. How do you remember hyoglossal membrane, right? These are just like such random big names, but no, they're not random. Hyoglossal membrane, if you break down the word into two, the first part, hyo, suggests that it gets attached to the hyoid bone, and glossal means the tongue. So, the median fibrous septum goes from the tongue and gets attached to the hyoid bone through the hyoglossal membrane. If you see in the picture over here, you'll be seeing that this is the median fibrous septum. And you can see how it is dividing the tongue into two halves, and all the muscles are arranged around it. As you can see, this is the Transversus Linguae, this is the Verticalis Linguae, and then all the other muscles of the tongue, which I'll just get into now. Now let's talk about the classification of the muscles of the tongue. Now, the muscles can be classified into two groups, and these two groups are based on, first of all, their location, and second of all, what their function is. So, the first group is called the extrinsic muscles. Why is it called extrinsic? It's not just anything random, it'll be very easy to remember. Extrinsic means outside, right? So, these are the muscles which attach to the which attach the tongue to a structure which is outside of the tongue. So that's why it is called an extrinsic muscle. Whereas the second group is called the intrinsic muscles. The word intrinsic means inside, which means these are all the muscles which are inside of the tongue and it does not get attached to any structure that is outside of the tongue. So these are the two groups, extrinsic muscles and intrinsic muscles. And if you had to remember how many are there are four extrinsic muscles and there are four intrinsic muscles. So this is very easy to remember. Now we'll talk about the names of the muscles. The extrinsic muscles are Genioglossus, Hyoglossus, Styloglossus, and Palatoglossus. Now, how do I remember such big names, like such complicated names? It's actually very easy. I'll just tell you how the name originates. Like, say, for instance, pick up Styloglossus. Again, as I've told you previously, just break down the word into parts. Stylo and glossus. Stylo means that the muscle is coming from the styloid process, and glossus means the tongue, as I've just said. So, this muscle attaches the tongue to the styloid process. Same as hyoglossus, for instance. Hyo meaning hyoid bone, and glossus meaning tongue. So, this is a muscle that is coming from the hyoid bone to the tongue. So, as you can see, these are very easy to remember. I'll discuss more about the origin and insertion in the next part. So, now if I had to remember, okay, what are the terms? Like, what is an easy way to remember? I have a mnemonic for that for you. The mnemonic says girl has superpowers. So, you can see G for Genioglossus, H for Hyoglossus, S for Styloglossus, and P for Palatoglossus. This is a mnemonic to remember names of the extrinsic muscles of the tongue. And the second group, the intrinsic muscles. There are four of them, which is kind of easy to remember. You don't really need a mnemonic here. You can just remember the orientation of the muscle. There are two muscles which are longitudinal. There's one which is transverse, one which is vertical. So just remember longitudinal, transverse, and vertical. And then again, the longitudinal has two different types, which can be superior and inferior. So now if I had to remember all the four muscles, they are superior longitudinal, inferior longitudinal, transversus linguae, and verticalis linguae. So these are my four intrinsic muscles of the tongue. Now, these muscles, the extrinsic and the intrinsic muscles, they have completely different functions. Since the extrinsic muscles are muscles which are attaching the tongue to another outside structure, like the hyoid bone or the styloid process, for example, their function is to alter the position of the tongue. Whereas the intrinsic muscles are all the muscles which are within the tongue. So these muscles are responsible for altering the shape of the tongue. So this is how you classify the different muscles of the tongue into extrinsic and intrinsic. There are four in each of them, and their functions are different from each other. So now we'll move on to discussing the muscles in details. First, we'll talk about the extrinsic muscles. We'll be starting with genioglossus. Now, genioglossus is the number one important muscle of the tongue, and it is also the muscle which forms majority of the tongue. The whole bulk of the tongue, majority of it is formed by this muscle. And this is a fan-shaped muscle. I'll show you in the picture over here. You can see this is genioglossus. So you can see how it looks like a fan. And very important part over here to remember that genioglossus is known as the safety muscle of the tongue. Now, why is it called the safety muscle of the tongue? I'll discuss it as we talk about the action down there. Now, genioglossus is a muscle that lies under the cover of mylohyoid. You can see in the picture over here that this is the mylohyoid muscle, right? This is mylohyoid. This is a cut section, like the mylohyoid has been cut and shown. But originally, what you'll know is that there is mylohyoid over here, and underneath that is the genioglossus muscle. Now we'll talk about the origin of the genioglossus muscle. It originates genio, the word, remember the word genio, and you can see over here that it originates from the superior genial tubercle of the symphysis menti of the mandible. So this in the picture over here, this is the symphysis menti of the mandible, and it will have a superior genial tubercle from which takes the origin of the genioglossus muscle. So hence the word genioglossus, because it takes origin from the genial tubercle of the mandible. Now, how does it get attached? Now, let's see that in this picture. It'll be very easy to remember. You don't have to even mug it up. So let's divide the muscle into three different types of fibers. The lowest fibers, this you can see, the lowest fibers get attached to the body of the hyoid bone. You can see over here, these are the lowest fibers, and it is going to attach to the hyoid bone over here. This is the hyoid bone. So the lowest fibers get attached to the hyoid bone. The intermediate or the middle fibers, these are the middle fibers, as you can see. These fibers, they pass deep to the hyoglossus. You can see over here, this is the hyoglossus. So it is passing deep to the hyoglossus, and they continue with the middle constrictor of the pharynx. And last of all, the uppermost fibers, these fibers, as you can see here, these fibers, they turn forward and upward, as you can see in the direction, and they get inserted into the tongue, extending from the root to the apex. This is the root of the tongue, this is the apex of the tongue. So all these muscle fibers will go right here, and they get attached into the tongue. So what did we learn? The genioglossus muscle, that it takes origin from the superior genial tubercle of the symphysis menti, right over here. And then how does it get inserted? We'll divide it into three different types of fibers. The lowest fibers will go down to the hyoid bone body. The intermediate fibers will go deep to the hyoglossus and continue with the middle constrictor of pharynx. And the uppermost fibers will go upwards and forwards and get attached to the tongue, inserted into the tongue from the root to the apex. And the nerve supply of the tongue is hypoglossal nerve. And last of all, let's talk about the actions of the tongue. Actions of the muscle. This muscle is responsible for a very important function. It is responsible for protruding the tip of the tongue. So when you protrude your tip of the tongue outside, the muscle which is doing this is the genioglossus muscle. And as a result of the protrusion of the tongue, you will see that the dorsum of the tongue becomes concave from side to side as you do that. So this is the function of the genioglossus muscle. And lastly, because it is because it is protruding the tongue, it is also responsible for preventing the backward fall of the tongue into the oropharynx. And this is the reason why it is called the safety muscle of the tongue. Because this muscle prevents the tongue from falling back into the oropharynx, and as a result of which it is preventing the blocking of the airway. Now, in case this muscle gets paralyzed or is not functioning, your tongue will fall back into your airway, and as a result of the obstruction of the airway, a person will collapse. This is a precise reason why this is known as the safety muscle of the tongue, genioglossus. Next, we move on to the next muscle. You can see in the picture over here, I'll just show you that this is the symphysis menti. This is the superior genial tubercle. This is where it takes origin from. Lowest fibers goes to the body of the hyoid bone. Intermediate fibers continue with the middle constrictor of pharynx, and the upper fibers get inserted into the tongue. So now we'll talk about hyoglossus muscle. Hyoglossus is a quadrilateral muscle. Genioglossus was a fan-shaped muscle. Now, this muscle takes origin. Now, again, break down the word. The word hyo is there, which means it is taking origin from the hyoid bone. Where in the hyoid bone? The upper surface of the greater cornu and partly from the body of the hyoid bone. So you see in the image over here, this is the hyoid bone, and this is the muscle taking origin from the greater cornu upper surface and partly from its body. And how does it get inserted? You can see in the image over here, the direction the muscle passes upward and slightly forward, and it is under the cover of the mylohyoid muscle. This is the mylohyoid muscle. Even the genioglossus muscle was under the cover of mylohyoid muscle. And as it goes forward and upward, it gets inserted into the side of the tongue between the styloglossus laterally and the inferior longitudinal muscle medially. We'll see in the picture right over here. This is the hyoglossus muscle. It has taken origin from the upper surface of greater cornu and partly from the body of the hyoid bone. It is passing forward and upward, as you can see in the direction, and it gets inserted into the side of the tongue, and the muscles, it passes in between the styloglossus laterally. This is the styloglossus muscle. So it passes between the styloglossus laterally and the inferior longitudinal muscle, which is this muscle. This is the inferior longitudinal muscle medially. And nerve supply of the tongue, a nerve supply of the hyoglossus muscle is the hypoglossal nerve. And the action of this muscle is that it depresses the sides of the tongue and it makes the dorsal surface convex. The genioglossus was making the dorsal surface concave, and this muscle makes it convex. And a small tiny thing to know about hyoglossus here, which could be like a short question that somebody asks you in a viva. What is chondroglossus? Now, chondroglossus is also a part of hyoglossus. It is the detached part of hyoglossus, which is separated by the genioglossus muscle. And this muscle, it arises from the hyoid itself, but from the lesser cornu and part of the body instead of the greater cornu. And it again it has the same functions as the hyoglossus muscle and the same nerve supply as the hyoglossus. So not much to remember, but just to remember that it is the detached part of hyoglossus, which is separated by the genioglossus muscle. Now we'll talk about a very important question: the relations of hyoglossus muscle. This in itself can be a short question in your theory papers in anatomy, and even it can be a question that can be asked in your viva in case you have got a case that is related to the tongue. So, the relations of hyoglossus can be divided into two parts. One would be the superficial or the lateral relations, and the other would be the deep or the medial relations. Now, first we'll talk about the deep or the medial relations. These relations, this is something you may have to just mug up a little bit to remember. I have also drawn a picture down so as to show you how you can demonstrate that when you write your answers, it is very important that you also add diagrams to it, which makes it easier for your examiner to understand that you have an idea about the concept, and as well as it is easy for you to remember when you draw a diagram. So the deep or the medial relations are the inferior longitudinal muscle, which is close to the insertion, the middle constrictor of pharynx, and the second part of lingual artery, which is close to the origin, and the stylopharyngeus muscle, glossopharyngeal nerve, stylohyoid ligament, and the junction of first and second parts of lingual artery deep to the posterior border of the muscle. So these are the deep or medial relations. Next, we talk about the superficial or the lateral relations. This is what you will be depicting in the diagram. First of all, I've already mentioned how the hyoglossus is covered by the mylohyoid muscle. So, if you remove the mylohyoid muscle, you will see certain structures which goes above downwards between these two muscles. Now, what are these structures that you can see from above downwards? So, you have to remember the direction. It's from above downwards between these two muscles. These structures are the mucous membrane of the side of the tongue, the styloglossus muscle, the lingual nerve, the submandibular ganglion, which is suspended from the lingual nerve by two roots, the deep part of the submandibular gland and duct, the hypoglossal nerve, which is accompanied by a pair of veins, and the suprahyoid branch of the first part of lingual artery. I'll show you in the image over here. This is the right lateral view of the tongue. As you can see in the image that this is the pink one that you see is the hyoglossus muscle. Now you'll see in the image that from above downwards, if you had to see, the first thing is the mucous membrane of the side of the tongue. Next comes the styloglossus muscle. Next comes the lingual nerve, the green structure that you can see. Next thing is the submandibular ganglion, and you can see that the submandibular ganglion is hanging from the lingual nerve by two roots. The next structure will be the deep part of the submandibular gland and the submandibular duct. Next structure is the hypoglossal nerve, which is the nerve supply for most of the muscles of the tongue, except for palatoglossus. And last part is the lingual artery. So you can see these are the lateral relations of the hyoglossus if you had to go from above downwards, which lies in between the hyoglossus and the mylohyoid muscle. So just copy this diagram and you can reproduce it in your papers, and it will be kind of easy for you to remember as well as you visualize it in front of your eyes. Next, we move on to the styloglossus muscle, the third extrinsic muscle. So if you again divide this word, it takes origin from the styloid process and gets attached to the tongue. So its origination is from the tip of the styloid process and the stylomandibular ligament. You can see in the image over here that this is the styloid process. And you can see how it is taking origin from it. And how does it get inserted? You can see in the image it is passing downwards and forwards. Passes downwards and forwards and it gets inserted into the side of the tongue, right, like here. The oblique fibers interdigitate with the hyoglossus muscle, as you can see over here. This is the hyoglossus muscle. So the oblique fibers will interdigitate with this muscle. And the longitudinal fibers, they continue with the inferior longitudinal muscle, which is right over here. So these are the longitudinal fibers which continue with the inferior longitudinal muscle. So nerve supply is again the hypoglossal nerve, and the action of this muscle is retracting the tongue backwards and upwards. This is kind of opposite to the action of genioglossus. I have told you that genioglossus is known as the safety muscle of the tongue because it protrudes the tongue and it prevents the backward falling of the tongue. Whereas styloglossus has an opposite action. So it is an antagonistic action. It retracts the tongue backwards and upwards. Next is palatoglossus muscle, which is the last extrinsic muscle. So palatoglossus, again, divide the word, it takes origin from the palatine aponeurosis. So it is taking origin from the undersurface of the palatine aponeurosis. You can see right over here. This is the palatoglossus muscle. You can see that it's taking origin from the undersurface of the palatine aponeurosis. So the palatoglossus muscle, it passes downwards and forwards as you see in the image, and it goes under the cover of the palatoglossal arch, which is the anterior boundary of the tonsillar fossa, and it gets inserted into the side of the tongue in front of sulcus terminalis. And most of the fibers are continuous with the transversus linguae muscle. And now, palatoglossus is the only muscle of the tongue which is not supplied by the hypoglossal nerve. It gets its nerve supply through the pharyngeal plexus from the vagus nerve. So, this is the only muscle that you need to remember the nerve supply separately of. Otherwise, all the other muscles are supplied by the 12th cranial nerve, which is the hypoglossal nerve. And the action of this muscle is that it elevates the base of the tongue and it helps in narrowing the oropharyngeal isthmus. So, this was all about the extrinsic muscles of the tongue. Now, we'll talk about the intrinsic muscles. First is the superior longitudinal muscle. I had told you the way to remember it. Remember that the different directions, the longitudinal, the different orientations, are longitudinal, transverse, and vertical. So there will be two muscles for longitudinal, one for vertical, and one for transverse. So the two longitudinal muscles are superior and inferior longitudinal. First, we'll talk about the superior longitudinal muscle. You can see over the image over here. This is the superior longitudinal muscle. This muscle lies beneath the dorsum, the mucous membrane of the dorsum of the tongue. It takes origin in the posterior part of the median fibrous septum of the tongue. It goes forwards and laterally and inserts into the side of the tongue. You will see that all of these muscles will take origin within the tongue from the fibrous septum and they'll all get inserted into the side of the tongue. Hence, they are called the intrinsic muscles. You can see in the image here that this is the superior longitudinal muscle. And this is the coronal section. And nerve supply is again the hypoglossal nerve. And the action of this muscle is to reduce the length of the tongue and make the dorsal surface concave from side to side. Next is the inferior longitudinal muscle. Again, it takes origin from the posterior part of the side of the tongue and it converges forward for insertion into the anterior part of the median fibrous septum. You can see in the image over here, this is the frontal section of the tongue. This first muscle that you see underneath the mucous membrane of the dorsum is the superior longitudinal muscle. And the muscle over here that you can see, this is the inferior longitudinal muscle. So this is opposite in origin and insertion to the superior longitudinal. This one takes its origin from the posterior part of the side of the tongue, right over here. And then it gets attached to the side of the tongue. It gets attached into the anterior part of the median fibrous septum. And nerve supply is again the same, the hypoglossal nerve. And the function is to shorten the tongue and make the dorsal surface convex from side to side. The third muscle is the transversus linguae muscle. Its origin is from the median fibrous septum, just like the superior longitudinal muscle. It passes laterally through the genioglossus muscle and it inserts into the side of the tongue. Nerve supply is the hypoglossal nerve and action is to reduce the width and increase the length of the tongue. You can see in the image over here, these muscles that you see over here, this is the verticalis and the transversus linguae muscle. And last of all is the verticalis linguae muscle. It takes its origin from lamina propria of the dorsum of the tongue. It passes downwards through the fibers of genioglossus and gets inserted into the sides of the tongue. So all the four muscles that you have seen, intrinsic muscles, out of them, 3 of them gets attached into the side of the tongue, whereas the inferior longitudinal muscle is the only muscle which gets origin from the side of the tongue and gets attached to the median fibrous septum. And again, the nerve supply of verticalis linguae is the hypoglossal nerve, and its action is to increase the width of the tongue and make the dorsal surface concave from side to side. So, this was all about the origin, insertion, nerve supply, and action of the different muscles of the tongue. How do you classify the muscles? How do you remember what are the extrinsic muscles based on their function and their attachment? There's a mnemonic to remember. Girl has superpowers to remember the extrinsic muscles. And lastly, I'll discuss one small thing. It's actually not much of a discussion, but rather a compilation. How do you compile these muscles based on their action? So there are muscles which make the dorsum concave from side to side, the dorsum convex from side to side. There are muscles which shorten the tongue, and there are muscles which elongate the tongue. So the muscles which make the dorsum concave are Genioglossus, Styloglossus, superior longitudinal, verticalis linguae. The muscles which are making it convex from side to side are the Hyoglossus and the inferior longitudinal muscle. And the muscles responsible for shortening the tongue are the superior and inferior longitudinal and the verticalis linguae. And the intrinsic muscle, which is responsible for elongating the tongue, is the transversus linguae. So that's all about the muscles of the tongue. If you have any questions at all, you can post it in the comments and I'll get back to you about it. See you in my next video.